So we're going to shift a little bit and talk about the addiction and rehabilitation, from opioids, both prescription and also the illicit drugs. The National Acupuncture Detoxification Association, what we call NADA, is an organization which and they actually they teach healthcare workers, so non-acupuncturists, this very specific technique, which is 5 needles in the ear. It's also called the 5-needle protocol. And you can see from the picture there exactly where they are on the ear. And this is something that was developed in the 70s in New York City at the South Bronx Lincoln Recovery Center. There was an outpatient methadone clinic, which was the first, or one of the first of its kind, truly. And they developed this out of some research that came out of Hong Kong using ear acupuncture for heroin addicts. And they developed this out of actually their own clinical experience. They were doing about 100 acupuncture treatments a day with their substance abuse program. And they found it increased endorphins, reduced sleep disturbance, reduced cravings, and had a feeling of calm. And so this association came out of that. There are, I know that these are statistics are outdated, but in 2000 there were over 500 addiction programs in the U.S. using some form of acupuncture. I can promise you that's a much larger number now. And in 2005, there was at least 1,500 addiction programs worldwide using acupuncture. And so the NADA protocol, these ear acupuncture, it's used for withdrawal from heroin, cocaine, alcohol, nicotine. I even use it for sugar cravings for patients. And it's also being used for PTSD, so in veterans programs and even disaster relief. There's something called the Acupuncturists Without Borders that does the ear program, the ear acupuncture in areas that need it. And the last one I'll mention is a study for neonatal abstinence syndrome. So it's unfortunate that the number of babies that are born with addictions to opiates is also on the rise. And this is a study that was done, that was just published last year, showed that they used a laser acupuncture, not needles on these newborns, a laser acupuncture in the ear and also body points, and it reduced the duration of the morphine therapy and the length of the hospital stay with the newborns. So it's definitely something that needs to be looked at. So I'll talk just very briefly about a case study, and then we'll be able to open it up for questions. This is a patient of mine who's 48 years old. She comes in with neck pain, shoulder pain, headaches, occasional numbness in the hands for over 12 years. Her pain level was 5 to 8, even with taking medication. The imaging showed that she had some stenosis, some narrowing in the C-spine. And she was on a number of medication, including a fentanyl patch, which is opioid, Neurontin, Vicodin with Tylenol, also an opioid, and Xanaflex, which is a muscle relaxer. And she had been through a number of different treatments, including epidural injections, an occipital nerve block, had prolotherapy, physical therapy, occupational therapy, massage, chiropractic, dry needling, some of which did provide some relief for a certain period of time, but the pain always returned. She was a patient of the clinics, was seeing one of the functional medicine docs, and she wanted them to see me for acupuncture for the pain relief, which she did for about 3 months. In addition to that, I did some herbal therapy, which I do like a customized herbal formulas, and I did this because she wasn't sleeping at night. And she had just a tremendous amount of stress and anxiety. And so, I was really wanting to address those kind of separately from her pain, because it's been my experience that if you address some of that stuff, the perception of the pain can change. And that's exactly what happened. So after 3 months, her pain had reduced to a 5, and she had started to come off of some of the medications. Her headaches were less frequent and less intense, and at this point she was rarely getting the numbness in her hands. She felt that her sleep had improved, her energy, overall her mood, and she started working with the prescribing physician. I have to say that, when I first saw her, she was really hesitant to come off of the opioids because she thought that if she came off of them, that she couldn't get back on. And because of all of the issues of prescribing, she just was really, really uncomfortable with the idea of coming off of the medication. And after doing the acupuncture and experiencing the pain relief with the acupuncture, she was willing to start to come off. Now, in this case, it took her about 6 months. She did stop seeing me because she was driving over an hour to come for treatments. But she has come off completely. At the very end, though, she started getting some withdrawal symptoms and had a pretty big spike of pain. And it was only after talking with her that, I was like, oh, you should have come back and gotten some acupuncture at that point. But so this is kind of a nice just case study of somebody who had acupuncture and was able to come off of their medication. Just because we're talking about advocacy issues, these are a couple different organizations with acupuncture, some local. One national organization that's getting involved is the Acupuncture Now Foundation. And they've actually put together an acupuncture opioid task force to help to just let people know that this is, a solution that's available. So take-home points, the overuse of opioids is a public health crisis in the United States. Regulatory efforts do not advocate for drug-free pain relief treatments, such as acupuncture, but acupuncture can be used to increase endogenous opioids and therefore the amount of opioids, and also help with addiction and withdrawal symptoms. So I hope you guys have a great evening, and thank you.